Since year 2000, Vardaan came into inception, and after that, we have treated maybe more than 10,000 infertile couples, and we have been able to give pregnancies through ART procedures. Vardaan Medical Center is providing all facilities of investigations and treatment under one roof since its inception. So patient doesn't have to go for their investigations or for any such investigations outside Vardaan. A patient comes here only with the option that they will be definitely adopting a single line of treatment which is ultimate and which has a better pregnancy rate, that is IVF. So test tube baby in layman's language, patient coming to Vardaan has been explained in a proper manner, and then only the initiative of treatment is been given. So any couple who comes to Vardaan first has to undergo a complete questionnaire which has been prepared by Vardaan, and those questionnaires are being asked by the medical officers or the counselors working at Vardaan. They have to answer their all medical history, what they have undergone the treatment and what type of procedures they have already undergone, so that a conclusion can be made that what should be the right line of treatment they should be given. We have a complete team of gynecologists, a complete backup team of surgeons, complete team of embryologists, complete team of medical officers working round the clock at Vardaan. A team of counselors who always keep the morale of the patients very high, so that they should understand that what problem they are undergoing and what is the treatment they are getting from Vardaan. These type of things, when it has been given to the patient, they definitely feel more positive, and then only the approach towards the center's treatment for them is beneficial. We have our in-house ultrasound color Doppler unit. We have our own laparoscopic surgery unit. We have our own sperm bank. We have our automated clinical lab where we have our own analyzers for hormonal assays. All these are investigations can be done immediately the moment a patient has been talked about the procedure, the investigation they have to undergo. And once these tests are being conducted, the report comes within 1 or 2 hours, so that a decision can be made that what should be the line of treatment or what is going to be the protocol we have to decide. So once the patient understands that this is going to be the line of action or this is going to be the treatment protocol adopted by Vardaan, a complete investigation procedures which starts from the ultrasound for the uterus, ovaries and the pelvis is been conducted on a female. The complete semen analysis is been completely done, so that we can see the sperms, the quality of the sperm, the motility of the sperms, and finally we can see the survival rate of the sperm, and accordingly the medication and the treatment procedures are adopted. To diagnose, we do all hormone profiles of the patient, a complete ultrasound workup of the female, a semen analysis, then maybe a hysteroscopy diagnostic or maybe operative depending upon the endometrial cavity or the uterine cavity. Then we definitely sometimes we have to do a diagnostic laparoscopy to see the tubal patency, the ovarian tubal relation, the tubal factors. So these all are the investigations which we conduct before we take the patient for an IVF program.
On the day of ovum pickup, patient comes to our hospital empty stomach. The patient doesn't need to be admitted for that. Patient comes after 36 hours of injection SCG. We take the patient in OT after preparing her. Short general anesthesia is given, and under ultrasound guidance with the help of biopsy guide, ovum pickup is done. With the help of biopsy needle, follicular fluid is aspirated. This fluid is handed over to the embryologist for further screening. In addition to our IVF OT, we have a IVF lab which we have equipped with 4 incubators, out of which 3 Heracell incubators and 1 Galaxy incubators we have. We have 2 laminar airflow, we have 1 centrifugation spermifuse machine, and we have 1 Olympus inverted microscope fitted with micromanipulator for ICSI.
Once everything gets okay and everything has been prepared properly, we see the complete investigations are being done and they have been completed. There is no problem with the investigations and patient can be taken up for an IVF program. Then a complete discussion on that particular case has been made by the consultants, and accordingly the patient is down-regulated or patient can be programmed for antagonist cycles. So this is how we take a patient for an IVF program in Vardaan, and we have seen the more stringent we are into seeing their all reports, they have to undergo all their investigation procedures, the more successful we are.
हमारे पास पेशेंट्स जो आते हैं वो डिफरेंट मेडिकल डिसऑर्डर्स के होते हैं, जो कि अदरवाइज इटसेल्फ पेशेंट को मैनेज करना डिफिकल्ट होता है, एंड मैनेजिंग द मेडिकल प्रॉब्लम अलॉन्ग विद द प्रेगनेंसी एंड दैट टू इन एक्सट्रीम्स ऑफ एज ग्रुप्स एंड डिफरेंट फैक्टर्स वर्किंग ऑल टुगेदर मेक्स अ वेरी रियल डिफरेंस. हमारे यहाँ पे पेशेंट्स 23 वीक्स पे भी कोई प्रॉब्लम लेके आते हैं, जैसे पानी छूट जाना या जिसके कारण से बाकी जगहों पे ऐसा होता है कि बच्चा हाथ से चला जाता है. यहाँ पे इतना हो चुका है कि पेशेंट्स विद 23 वीक्स प्रेगनेंसीज कमिंग विद कॉम्प्लिकेशन हैव टेकन द बेबी बैक टू देयर होम सेफली.
A privilege of Vardaan's treatment, a couple coming from Canada after 23 years of marriage, getting an IVF done and having triplets from Vardaan, which was the first triplets Vardaan had given for a Canadian NRI couple. A female at the age of 56 lost her son at the age of 22 years, getting an IVF done with a donor egg program, conceiving in the first attempt and finally delivering twin males. We have a privilege of a patient who had a polio in childhood, finally getting married to a normal male and getting an IVF done. She had conceived in the first attempt, getting a female. Now again she came for an IVF treatment from Vardaan after her daughter became 4 years, and now she is pregnant with a twin pregnancy, which is a remarkable achievement that patient has made, the dedication of the Vardaan team and the spirit what she had shown to become a mother again.